This is Sg2 Perspectives, a weekly conversation between the Sg2 intelligence team and industry thought leaders about the biggest trends in healthcare. We're happy you joined us today. Enjoy the episode.
Human work shouldn't just focus on pure production. It needs to focus on the surrounding factors that help build sustained impact on an output. We as the humans, ultimately, we're the ones who have to align stakeholders to a given cause. We have to evaluate trade-offs, own the consequences of an output. But also in the space of creativity, we don't want to just get lost in ideation volume. We're not here to just produce a bunch of stuff as quickly as we can.
Welcome to Sg2 Perspectives. I'm your host for today's episode, Jayme Zage. Today's topic is artificial intelligence. And as adoption of AI continues at its breakneck pace, our AI thought leader, Andrew Rebhan, continues to get more interesting and complex questions, not just about the clinical and non-clinical applications, but about what it means for our workforce and how we do the work. Andrew, welcome to this episode of Sg2 Perspectives.
Thanks, Jayme. Happy to be back.
Let's start by introducing what has been driving some of the questions you've been getting lately. What do those conversations look like that you've been having with our clients?
The conversations with AI have not slowed down over the years, as you might expect. As I'm in conversations with healthcare leaders, even when I'm on the road doing presentations, we cover any number of different topics within this space. Tapping into the workforce has become a bit more of a prominent issue this year. It's likely tracking with the headlines that we're starting to hear about, namely a lot of the tech companies. They're now starting to openly acknowledge that their investment in AI is leading to rounds of layoffs. That's making people nervous again, but it's bringing up this conversation of assuming investment and scaling of AI is going to continue. What does that mean for the workforce? And what does it mean for the skill sets we as humans bring to the equation? And what does that mean for matters of role redeployment and evolution, roles that maybe we hadn't thought of that are going to need to evolve in this near future? This is a conversation where we don't have a lot of easy answers, but we certainly have a lot of healthy debate and opinion.
Tell me more about the workforce implications in the healthcare space. We're not seeing jobs eliminated yet, but what we are seeing is how people work is changing.
Looking at some of the economic reports, it does seem that healthcare, given the shortage of talent and the importance of the work, it's been a bit more insulated to some of the job effects of AI than some of the other industries. But we don't want to fool ourselves in giving a false sense of protection to this industry. Technology is permeating every industry, and healthcare needs to adapt to the idea of if we look at AI competencies or what AI is ultimately meeting or outperforming humans in, we know it's faster than us. We know it's readily available 24/7. It's good at repetition. It's better at prediction. It's better at scalability, right? These are just things that as humans we're limited by, and AI is already more or less outperforming us in those areas. But that sets up the other side of the coin, which is to say, what does that mean for what we define as human competencies? What's interesting is that I used to have a slide. I've actually kept it in my Rolodex of presentation material. It's a real simple split to say, we kind of know what AI is good at. What are humans good at? And what's funny about this slide I used to present, the title of the slide was AI is not a jobs killer. I had to get rid of that title because I felt like I was being dishonest when, especially this year, I started to hear more and more headlines and stories of widespread layoffs. And so I thought, I got to fine tune this and I need to be more honest with how I'm interpreting what humans are good at. You could say that we have these competencies we'd like to think are truly something that we're either innately good at or something that defines us as being truly unique in some way. But when AI starts to embed new layers of reasoning, when it starts to pour over massive data sets, when it starts to now get into the space of agentic AI, where it's making semi to fully autonomous decisions, now it's starting to increasingly creep into more and more of what we think are human traits or human skill sets. As part of this thought experiment, I actually asked the Vizient AI community of practice, which is our own internal community network where all of us colleagues can brainstorm and share ideas and talk AI all day long. And I posed this question to that community and said, help me think through this. And there was just a flood of different ideas of key traits they felt humans still have an advantage of in the age of AI.
I remember that dialogue being part of that community as well, right? That was an interesting conversation with a number of people across Vizient who are very focused on where AI is going.
There's a couple of points we could bring up. This is where that healthy dialogue was coming out, because as an example, in that slide that I would always run with over the years, I used to say that a human competency is creativity. It just felt intuitive. It felt like we're generally good at creating content. And yet, when I think about the emergence of these latest AI tools, the ability for them almost right out of the gate when ChatGPT came out and people started exploring with its capabilities, for these tools to generate a poem with any number of parameters and it could spit it out in a matter of seconds. And then as it started to become multimodal, AI started generating art that was actually winning art contests. And it was now starting to generate whole movies. And we've seen videos that are popping up on YouTube and elsewhere that are so convincing, right? It's increasingly difficult to actually tell what's been made by a human and what's been made by an AI. Now, there's pros and cons to that, but it sparked the idea of, if AI is able to generate all of this on command, seemingly limitless capability, is that not a spark of creativity in some way? The debate was, it may emulate creativity, but it's not necessarily conscious of what it's doing creatively. It's pattern matching and generating information based off of a prompt, which is valid. If AI is capable of doing something in some way, however big or small, do we still consider that an entirely human trait? Or do we feel like now it's becoming something shared, and so we can't say it's a distinctly human trait? I'd be curious what you think about that. Do you think AI is creative, or do you think there's something kind of hollow about its creativity overall?
I was definitely on this side of someone who thought creativity is something that is uniquely human. And I would argue that the ability of AI to create is dependent upon that human prompt. If you don't prompt it to do something different, if you don't give it that unique perspective or that unique direction it hadn't seen before, it can't go there. And it may just be where our creativity is leveraged in AI to create something new using AI as our tool, like you would a paintbrush or a typewriter. It's another tool to do that. And as you said, it's faster. It helps us do that faster than we ever would before. But I think the creativity part is still in the human realm.
That's great. And that actually gets to a couple of the points that I ended up bringing out in this blog that I published, where we sort of settled on the idea that AI can make a bunch of things, but humans are ultimately the ones who make the meaning. We get away from the idea that human work shouldn't just focus on pure production. It needs to focus on the surrounding factors that help build sustained impact on an output. We as the humans, ultimately, we're the ones who have to align stakeholders to a given cause. We have to evaluate trade-offs, own the consequences of an output. But also in the space of creativity, we don't want to just get lost in ideation volume. We're not here to just produce a bunch of stuff as quickly as we can. And this is where, in the context of AI, a lot of people are pushing back on what they're calling AI slop. The idea that we're producing more than ever before, but a lot of it is just kind of thoughtless, hollow content that people are just spitting out using an AI tool. We need to get back to the idea that defining what's creative, or even defining what's empathetic or what's funny or what's meaningful, ultimately it's on us as humans to set the kind of parameters of what good looks like, what are the constraints, what are the quality benchmarks. That's part of our role there in that context. Another one that was interesting was the subject of empathy as well. This gets to the heart of healthcare as far as the dynamic of a caretaker to a patient. We know for years this dialogue has centered around how clinicians are burnt out, always seemingly behind in terms of keeping up with the bottleneck of care. And part of the translation there has shifted to how some of these AI chatbots in studies have been rated higher in terms of empathy, as far as drafting a note in the patient portal, responding to basic questions. There's controversy around how those studies are structured, right? People pick apart the methodology, and I think that's fair. In a lot of cases, those studies is they're not really replicating true practice. They're set with very specific parameters. But nonetheless, if we take them at face value, there are multiple studies now indicating that an AI generated response is rated higher in a blind study than a human generated response in terms of empathy. That's a discussion that's uncomfortable, but it's something that we need to have. We need to have that kind of honest dialogue to say, why is that the case? Can we leverage this in a way that allows a clinician to still communicate, put their fingerprint on the message, still verify, still personalize it and fine tune it, but still leveraging the efficiencies that AI is bringing to the table? Empathy was another area that was really interesting. And even though it's not literally empathetic or consciously empathetic, if it's able to construct a message to a patient who is nervous or dealing with depression or has some other kind of need, and that message, as it's composed, helps to alleviate those challenges, does it actually matter if it was written by a human or not? I feel like it doesn't. If it's ultimately addressing the need, that should be enough in some context. We know there's always going to be an exception. The trade-off to that was, well, humans ultimately should still be responsible for the messaging. And they also need to still feel like they're giving a sense of genuine support to the person on the other side, especially in high stakes interactions. That's just kind of where we went down that road. But what do you think?
I agree. I've seen some of the same studies that you're talking about here, where the email responses or the portal responses through an AI agent feel better to the patient. Couple of things that you brought up here. Certainly, if the provider isn't crafting that message, are they connecting to the patient themselves for their ability to stay invested in that patient? And that's part of it. This gets into a little bit of a darker area, is that when these chatbots are dialoguing with individuals, they may not always perceive or may not have the right intuition about what's not being said and what's between the lines. You talk about that in your blog as well, this importance of being accountable, but also using your own perception, your own knowledge, and your own gut intuition about what's really going on with that patient and why they're asking that question. That's where we've seen some issues, in particular in the mental health space. AI hasn't always kept up to what it needs to do and has actually been harmful in some cases.
You get to a couple of other measures that we certainly discussed. We could say a clinician or any other human stakeholder, and the fact that they still have an advantage as far as perceptivity, intuition, reading the room. There's things that happen within a dialogue of a patient visit that's not always openly expressed, but a true human expert can ask the right questions to get to a layer deeper or not being explicitly stated. This speaks to this interesting dynamic that we've heard over the years about how diagnosis is sometimes part science, part art. It's based on years of acquired knowledge and expertise. It's based on observation skills that are both objective as far as labs and tests and imaging, but also more subjective based on gut instinct. It is on humans ultimately to have that awareness of the person in front of them and the surrounding context that helps them to validate a lot of the output that may be coming from an AI co-pilot tool. The human can still rely on an AI to summarize and capture the visit and provide some kind of clinical decision support or nudges, but the human is still ultimately the one accountable who has to evaluate the output, spot the nonsense that may be occurring in the output. We've heard of the risk of hallucinations, confabulations, or biases, but also being able to pick apart what are the right follow-up questions that should be asked here. And ultimately, this just gets to the idea that judgment is still going to be a crucial human competency here as well. That kind of judgment always aligns also with matters of accountability. There's this rise of agentic AI now, which is still fairly early days, but we're starting to hear more and more conversations and examples with health systems that are starting to test out these more autonomous bots. Going back to that initial debate of what's a human competency versus an AI competency, the area of judgment was something that I started to question. This was actually something where I got a bit of pushback from colleagues who felt like judgment is still in the space of the human expertise. Now that we have autonomous bots and systems of agentic tools that are starting to be deployed, that starts to sort of muddy the water a little bit around humans fully owning judgment, because these bots are leveraging step-by-step reasoning. They're considering options, and then they're starting to proactively initiate action towards some goals. Those are flavors of judgment. And so that raises the stakes for the humans in the equation to say, we have to set the appropriate kind of boundaries around these systems. We need to have explicit decision rights. We need to have clear escalation paths, be comfortable with understanding that these bots may do certain actions, but ultimately we're the ones who are going to put our names on the dotted line to say this was the right decision. That opens up so many other questions around the risks and the liabilities that come with these technologies.
I was on a quality panel recently with some of our Vizient Network members, and we got a chance to hear from Moffitt Cancer Center. And they have a text-based programming, but it's driven by an agentic AI to work with their cancer patients in between visits, checks in with them on a regular basis to see how their symptoms are unfolding, especially after chemotherapy treatment, which can cause a lot of negative side effects. What they did with this chatbot approach is what you're talking about. They built in the series of questions, and based on the patient's response, it makes choices. And there are some things that will trigger escalation to a provider. Certain things going on with a patient, it escalates. Part of it is to keep patients out of the emergency department in between their therapy visits or prevent that unnecessary care, is that when a patient falls through, they go back and do a review of where did this fall? How do we need to improve our chatbot? That accountability you're talking about, we have to set the guardrails as we learn where AI fails us. That's the piece that's still very human controlled. And AI isn't doing that for itself yet.
This is also why governance continues to be really a consistent theme in all of our discussions. It actually ramped up again going into this year. The technology keeps evolving rapidly. We are starting to see some unfortunate real world patient harm stories coming out. We're starting to see lawsuits spring up against some of the big tech companies. And so we're just at a pace where everything's moving so fast. And yet we need to get some boundaries around the capability of these tools, especially as they're now starting to become essentially autonomous in a different way.
To bring this back to our healthcare leaders and what it means for them, what do they need to be doing to balance the rapid pace of adoption along with making sure that their clinical teams, their administrative teams are keeping up, overall managing those potential clinical and business risks?
Leadership is going to remain crucial in this transition period for a variety of reasons. If you're a leader at a health system, you need to think about how are you going to manage stakeholder alignment, set the vision for the future of where your organization needs to go. How do you think about aspects of change management for the long term? How are you shaping culture within your organization? And part of it really comes down to honesty and transparency, understanding there are roles that will be directly impacted by this technology. And I know those conversations are happening behind closed doors and it's uncomfortable. We're in a space where we need brutal honesty. Once we have that clarity, that's where we start to alleviate the either outright resistance that's coming from some workers, or we start to think about the appropriate support structures that we could build into upskilling and reskilling the workforce to better prepare them for the higher value work that we need them to do, and let AI handle the rest, more or less. Having leaders that can provide clarity for the strategic goals of the organization, they can mobilize the workforce around those goals and set the North Star of where we want to go. That goes a long way to building trust in how we're leveraging the technologies. It helps to define what are the real incentives at play here. That's also another big factor that ultimately steers how we best leverage the technology and how we think this ultimately supports the organization's goals. Leaders need to build that burning platform for change. They need to be able to showcase where this is going to make their staff's lives easier for the long term. All of that, it's not easy. It doesn't happen overnight. It's going to be a consistent struggle. And we're just going to continue to have these challenges. That's ultimately the role of leadership. You got to be able to navigate those difficult decisions, be able to bring your staff along with you on that ride to really ensure that everyone is motivated the right way, but also being taken care of along the way.
Absolutely. That's a great way for us to end our episode today. Thank you, Andrew, for sharing your thoughts. It's always wonderful to have you on an episode. And thank you to our SG2 Perspective listeners. Until next time.
Thanks for listening to this episode of SG2 Perspectives. Please don't hesitate to reach out to SG2 if you have questions or suggestions for future episodes.